Hi, good morning. My name is Cristina Nunes. I'm from University of Algarve, coordinator of this wonderful training school. And it's wonderful to receive you and host you in the University of Algarve. We are doing all the sessions in this room. We are having lunch in the campus. We will go with you all together. I would like to present you the staff team. Carla, João, and the other two girls that were downstairs and registered. You can ask you money, Rita and Laura, and everything you need or anything you need, you can ask them, okay, or me, or Katia. So we are
Good morning.
the local organizers, okay? So we are having two lectures in the morning. Oh, no, sorry, one lecture before coffee break that will be downstairs, and we all go together. And at 13 we are going to lunch in campus, in the university restaurant, and we are all together, so you cannot lose. Anyway, we are watching you anytime. So welcome and enjoy. And I'm going to give the word to Lucía Jiménez, the coordinator of the project.
So, good morning, everyone, and welcome. Thank you, Cristina, for the introduction and for welcoming us as hoster of this training school. And I have to start saying thank you for the wonderful organization, because, well, we are in an uncomparable framework, and you can see the pine trees and everything, so it's the most wonderful place to stay. And also at the academic level and at the human level, I think that you are a very good team, so thank you for organizing this. There are a few of you that you know already Eurofamnet, and that's, I think, a good signal that what we are doing is interesting and is capturing your attention. And we are really proud of this activity today, and I'm talking on behalf of the network and also the Vice Chair, Professor John Canavan, that is not able to join us today from the University of Galway, because a few years ago when we started with this project, our idea was trying to connect the researchers in Europe that were interested in family support. So one of the main activities has to do with engaging and involving new researchers, as you are, and your researchers. And we are really highlighting this activity in the network, trying to, well, promote activities that are interesting for that purpose. We have here Sofia Baena, who is our Young Researchers Group Coordinator. So for those that you are not yet members of the group, I am, well, inviting you to talk to her and join this family that is about family support. And, well, and with the aim of the purpose that to talk about quality assurance in family support in Europe, that will be our topic for these 2 days. So I'm not extending more, but I think Alejandro, he's our money boss. He has a formal position, but that's the real one.
Hi everybody, again, let's talk about something less fun, money. Okay, after the training school, you have to claim your reimbursement, okay? As fast as you claim, as fast we can pay. That's easy to understand. So do it, please. Okay? If you have any doubt, something about, we have the email. It's Fuse International. Maybe it shows in the website cost. So don't hesitate to contact me for any other questions. And it's easy. You have to fix or apply for the money, for your flight tickets, everything. That's important. Upload every information, okay? Not only the invoice, also the boarding passes, everything. If something is not necessary, I drop off by myself, okay? Thank you so much. Thank you.
Thank you.
So we have a really interesting maybe good to say this because we are speaking in the first instance, but for the 2 days there is a panel of experts and colleagues here. I'm saying thank you for being here and devoting the time to talk about what the work we are doing, and not only inside the network, but also outside. We have Martin Leche here from the European Social Network that will give us also an outside perspective on the policy and practices field, what I think is very interesting. Let's see if I'm able to work with this. So I don't know if there is any urgent matter or practical thing that you want to ask or comment before we are starting. ¿Quieres que le digan un momento más ¿Sí? Do you want, maybe it's a good idea, some of us, we know each other, but maybe it's a good idea that they say, hi, I'm Lucía from University of Seville. And María José.
Well, María José Rodrigo, I will be also sharing with Lucía the first talk. I'm from the University of La Laguna, and I've been working very much on the topic of family support.
So, we take you the mic.
Hi, I'm Keita and I'm from the University of Porto. Hi, I'm Sophia from the University of Loyola.
Hi, I am Faustino from the University of Padua.
Hi, I am Pablo from Universidad Isabel Rivera.
Hi, I'm Mima from the University of Manila. I'm Lucía from the University of Jiménez.
Hello, my name is Isabel Bernero from Malaga University, and I'm part of this project coordinator of José.
Hi, I'm Anna from the University of Malta.
Hi, I'm Lynn and I'm from the University of Malta.
Hello, I'm Ana Pizarro and I'm from the University of Seville.
Hello, I am Elena. I am from the University of
Hi, I am María and I'm from Catholic University of Wales.
I am María and I'm from the University of José.
I'm Violetta and I'm from the University of Dublin.
I'm Galen and from the University of Amsterdam.
My name is Berlin and I'm also from the University of Amsterdam.
I am Juan. I'm Francisca and I'm from the University of Malta.
Hello, I'm João and I'm also from the University of Malta.
David, I'm from University of Malaga. Apologies for being here, but
I'm Martin, I'm from the European Social Network, and tomorrow I will present you on our work on politics, social services, and how it relates to EU action on politics.
Thank you, Martin. Thank you. So we are coming from myself, educational psychology. There are other people from psychology also. I think we have a background around that. There's people from social work and other areas. Where we from? What's your discipline? The social education. Okay. Pedagogy, social education was your field also? Okay, and you and yours?
We are psychology.
Okay, so, well, thank you for the introduction. So I say that this is the first talk of the training school. I will start a really brief introduction about the network because I know that some of you are familiar with the network. But just for those that is your first time with us, and I hope not the last one, just to let you know that this is a network that started a few years ago with the intention to exchange the knowledge and all the skills and tools that family support researchers had in common in different European countries and beyond, with the purpose of advocate evidence-based family support and with the ultimate goal to make a real impact in children and families' life. And with that purpose, we have been funding for 6 years by now by the COS Association, that is a European framework, research framework. And we have been operating, this is a mainly research-based network, but also in interaction with other key stakeholders. And this is very important because the topic and the purpose of this training school has to do with the practical impact that your research has in real life. And you have been asked to think about that and develop about that. And this is the line that we will be discussing for these 2 days. So just to let you know that what we have been doing is start from the, that knowledge that we have at the local and national level, share that, hearing all the relevant voices, and that's the reason we have this dialogical style, trying to include what the policy and practice perspective has to say, also what families and children representative has to say, the voice of practitioners and so on. And we are following what we call a double layer structure, and I think this will be clear as long as we proceed with the presentation, because we are trying to work at the national level, and for example, my colleague Isabel Bernedo referred to the national working group, and we have here the Portuguese national working group, and also to reflect that at the European level. So we are trying to produce that iterative dialogue with the purpose of having an impact at both levels, how the European lessons can impact the national level, and the opposite, how the research we are producing at the local and the national level can impact the European level. So we have been working in these three areas of content that, for those that are involved or have been involved in the network, you know well. And I'm not going into detail, but just to let you know that we have a website that is public and everything that we are producing is open. So as young researchers, you might be interested in go there and look at in-depth look about further products, and that's the reason I'm referring to this. One of our, well, these are our main contents or working packages, you know, the projects are organized in that way. So you have information about how family support is being delivered in Europe, and you will find relevant tools that has to do with the conceptualization of family support in Europe, but also with the family support provision in different countries. So mainly academic outputs, I would say. You can go there and see interesting materials on that regard. We have been also progressing in regarding quality standards and evidence-based programs, and you have some academic outputs regarding what are the quality standards that should be taken into account for family support provision, but also you have in the toolbox section, you have a catalog of family support programs that are feed by different countries, so you can go there and find information about those. Also evaluation tools, and also quality standards agencies, so you can go there and find not only academic but also practical materials that can be interesting for making research and also for practitioners and policymakers to have an impact on research. And finally, the third area that we have been progressing has to do with practitioner competencies, so the workforce skills that are necessary for family support provision. We have been talking about our own disciplines, and family support is at least multidisciplinary field, and because of that we are really interested about those interdisciplinary skills and competencies, and you will find again both academic and practical tools that you can find interesting. For example, what has to do with international agencies that have been researching on skills, and also a framework for understanding interdisciplinary skills in family support. One final concept that I would like to share with you as an introduction of the network, and then I will move specifically to the project today, is what we call our foundation as a network. And I think this is the spirit of what we are doing, and also is a relevant core content to have in mind these 2 days when thinking about how can we make an impact in children and families' lives. We have a policy and practice group. Martin is here as member of that group. Well, we have different representatives both at the national and the European level, and they are constantly helping us to think about how what you are doing is improving life of children, is improving life of families. And that's our framework. And that's the reason I'm saying the research we are doing is advocating for an evidence-informed family support provision in order to make this real impact. And we like to say that we try to be placed in this intersection that is not easy one, and we try to reflect and review our work and see if we can stay here. We are, most of us, we are researchers, so probably we agree that there is no point in having policy and practice without research, because that can have undesirable effects. But also we need to have the consideration of practice and policy altogether, because if we only work or combine research and practice, we won't gain systemic change, and the opposite, if we work or we interact research and policy, we won't make a real impact in children and families' lives. So the reflections and the research that we are producing try to be placed here And something that is very important, and we will be reminding, I think, these 2 days, is that rights of children and families are the basis of our work, because we are working with right owners, and that's very significant in our field. So, specifically in this training school, we are focusing on 1 year project that is really challenging. That is quality, is named QA for Eurofam, is quality assurance in family support. And this is well, it's not an extension, but it's a new project that starts from the work that we have been developing in the last 5 years. And we are trying to support countries where there are 23 countries involved, 20 of them making an analysis at the national level that are covered in the slide. And the purpose of this project is see how can we take all the learning that we gained in this network previously and support countries to better improve the family support provision that they have in their countries. And this quality assurance approach is something, and I think that probably Martin will refer to that tomorrow, that has been a priority for Europe. There is a framework about quality assurance for social services. It's a voluntary framework, and one of the lessons that Europe is obtaining is that the countries are not implementing as much as would be convenient this quality assurance framework. And also, maybe you are familiar with the new recommendation of the European Commission for integrative protection system for children in the framework of the child guarantee. And there is a specific claim of having both family-based support and quality family-based support. So there is no longer a question about if there is a point to support families, but the question is how can we do that with a quality guarantee behind. Europe is large and there is a lot of variability, and that means that we have to consider ecological validity, and we have to be sure that what we are doing has a real impact and has into account differences between countries and between regions, but at the same time we have to share a quality assurance framework that can help us to tell at the end we are improving the life of children and families, we are guaranteed children's rights. So with that purpose, today we will be focusing on this quality assurance protocol that is a practical tool, is the way that we have adopted to try to make an influence, to have an impact both at the policy and at the practice level. And this is a starting point for us. So we see the network and our work, I could say, I think as researchers, as a long life, a developmental story. So this is not only a 1 year story, but this is the starting point for something that we hope that can be sustained and can be extended through the time, and that help our countries to learn about how to improve and be better. So for that purpose, what we have done is developing a quality assurance model, and now Professor Rodrigo will give more details about that. And the first thing that we can say is that we didn't have previously a quality assurance model specifically for family support field, is what I mean. So we have European frameworks, and I have been referring a few, and we have very good experiences, and Martin will talk about their own experience tomorrow. But in the field of family support, we were able to learn from that, but we have to start a new framework. And what you can see here is a kind of metaphor of going in depth about what is going on in each country, because I referred previously to this double layer structure. What we are doing now is strengthening what we call national working groups. So in each country, we have identified who are the key stakeholders, the key actors in family support, and we have asked them to work together for this purpose. And in those groups, you have representatives from the national governments, local governments, practitioners, NGOs, families and children representatives. So we have been identifying in each country who is the relevant people that should be talking or should be reporting on quality assurance. And that's the reason that we refer to a systemic approach, that this is an approach that has been claimed by the European Commission on societal challenges. I don't know if I'm naming well, but saying that if you want to produce strong evidence, you have to go to the local and to the global, and that's the approach that we are trying to to have in our network. With a partnership that is multidisciplinary, cross-sectional, and multi-agent or multi-agency. And as we will be able to discuss now, this approach is strengthening what is called the evidence ecosystem itself. Only just having the possibility to sit in the same table, a group of people with different languages, different approaches, and different disciplines, and think together what quality assurance means for you, how would you rate your country, where you think your country is on this regard. This is creating already change, and it's creating what we call evidence culture, and it's provoking a change. And as I say, the purpose is to be developing. So we are focused on training, for sure, in self-assessment with this perspective of the rights base at the end. So this is quite introductory, but I will give the floor to Professor Rodrigo, who will give more details about our model.
Thank you very much for this wonderful introduction. Yes, we are going now to go deeper inside this protocol. But I think the first idea is to see how can we make a quality assurance protocol, because it is really a challenging task. And although there is some attempts in other fields, for instance, also in social educations and specific educations matters, but not especially in this family support framework, in which we are almost interdisciplinary, but the focus is on quality family support, and that is a very specific matter. And so I think we should start, when we are thinking of this quality assurance model, we should start in the kind of application field we are going to use. And that is exactly what I've been saying, that our application field is the family support system, the quality family support. This is our application field, and so we have to devote on that. And that is, at the same time, is restructuring, but creating some restrictions and boundaries, but I think it's worthwhile. Because the family is the kind of entity that takes into account and gets in contact with all the prevention system, all the protection system. So what the family can say about their well-being or the things they got depends on the quality of the relationships that are establishing with all the network of services. Education, health, justice, community, etc. Is the kind of agent that it should be taken into account just because they know everything. They know everything in terms of the quality of the assistance, of the attention they receive. And they are the kind of agent that really not only are the target, but are the main informant on that. And that is very critical to have in mind, because it's not just the end chain of the long system, but they are really protagonists. And also you will see that they are also subjects of rights. So then we have to be very, very respectful with the family and to find a way to get them really, really feeling much better. And so when we have the application field, we have to come to the objectives. What are the really objectives we have for creating this protocol? But then we have to start with the principles. The principles have been worked out quite frequently. For instance, universality. No? For instance, efficacy, things like that. So it has been developed also in some other fields, so we can take advantage on that. But we have to think of the family support system. But then, and that is a matter much more complicated, is to go down to the quality standards. So that is the kind of thing that should be done to have a good quality care. So that is more complicated. It comes from the principles. You have to start with the principles, but then you have to go down to this level of the quality standards. But that is not enough, because we have to find out measurable indicators, because the quality standards are quite general still. So we need to see which kind of indicator reveal to what extent this standard is achieved or not. And that means going better into the details to see and to reach a kind of productions or sentences that give you exactly the meaning we are achieving with these quality standards. In this moment, we have used several indicators for the same quality standards, but then you will see that when we apply systems to simplify and to do some reductions on that, then we come up with at least one indicator for each quality standard. But it can be, I think it's more completed, we have more. But at this level, it is a kind of limit that we have from the very beginning, not to go so broad and to go more deeply in capturing in just one indicator the substance of this quality standard. But then we got the results that we are going to also to present. We are very happy with that finally we come up with the final, not the final, but at least the results. But let me go a little bit back. Why do you have to use quality standards? Why? Because we are in the movement of evidence-based movement. And you know that this movement is not just, it wasn't created in this field, in this social science field. It was created in the medicine field. And that creates some changes. That means that we had to make some changes, or at least some qualification in the way we really understand what does it mean evidence-based in our field of social intervention, social science. Because there have been some reluctance and some doubt to what extent we can apply directly what is happening in the healthy domain into the social care domain. Because it's a different matters, different targets, different objectives, etc. And so let me go a little bit to explain that the first idea comes to our mind is to change from the idea of directional, from science to the practitioners, to the patient, let's say, we are talking in terms of health system. Health system, to give you an idea, they got the first foundation of this evidence-based movement in 2001. So they did it a lot of time, and it came into the psychology, but with clinical psychology in 2006 with the APA formulation. So that was the first field that approached more to our field, but not yet to completely in our field, because it's just clinical psychology that it goes a lot of links with with the medical stuff. So in that case, we should think that of course the triangle is there: is science, is experience, and is the client or the user. That's clear. It's the same structure, but we have to change something, some important things. When we are talking about science, what is kind of scientific evidence we are referring to? Then we have to think, first idea, a pluralistic approach. In our science, we do not have only quantitative methodology. We have qualitative methodology and we have mixed methodology. And we have to take care that the evidence is completed and is drawn for all these sources of information, not only quantitative. That is the very first idea that has been said by other people. For instance, John Kahneman has written on that. It should be pluralistic, and also pluralistic depending on the phasing you are. For instance, for more descriptive, for more first approaches, qualitative is the best, because you do not have to assume a given questionnaire when you do not have anything as a priority. So you have then the pluralistic, of course, that is an idea. But look at that. We are talking about relational versus directional. What does it mean? That this information has to be also worked out with the practitioner's point of view. And also taking into account the evidence they have been gathered in the field. And let me go back a little bit to the scientific evidence. Another matter of this scientific evidence has been taken from community settings, not only experimental settings, because in the medicine, of course, there can be also community medicine, of course, but mainly of the evidence, the bulk of evidence, come from experimental evidence, which means going in ideal conditions and doing mainly efficacy trials. Whereas when we move into our field, we have to endorse more community-based evidence. That means at least 4 things that are not there. To what extent the family needs are met. I have a wonderful program, but to what extent I know that my program has been targeted to the family needs, because it had to be fitted with that. So family needs are important. The second one is to what extent the intended population has been reached. When I'm doing a laboratory essay, I know the intended population. I bring the people that have this problem, this cancer, this whatever. But in our case, which is the intended population? Do I been able to reach the intended population? For families in high need is not always the case. The professionals complain that they can only reach the kind of people that always come, but not the most in need. So that is a big problem. It's the non-take-up problem that has given a lot of work, not especially in the parenting literature, but it's very important because it gives sense to the idea of spending money on social benefits. When you know that those people that are eligible do not finally accept to participate. Well, it can be a talk on that because we are just doing this kind of research now. But we are very happy. Finally came that family, and this is the profile. But then you say, oh my goodness, not high level of, let's say, risk, not really high needed family. The ones I know that they are not here. So something, it's not wrong, it's not wrong idea, but it's something that you have to take into account. When you go to the results, when you generalize, when you say something, you have to be humble and recognize that you have reached not probably the big intended population you are thinking of. So that is the second one. And the third one is the quality of implementation. In a lab, in experimental, well, implementation is very easy. It comes to the lab, I give a pill or whatever. But in the community field, the implementation is the great deal, is the most important thing. Otherwise, you cannot say what happened if your program is really efficacious or not. And you also speak about effectiveness. Effectiveness, not efficacy. Effectiveness is a different matter that takes into account the quality of the implementation. Because we are talking about multi-site studies, not only the study has been done once and repetitive studies, and so you have to take care of all of that and to describe the kind of environment and the kind of system you have been followed for delivering the program. That is crucial, the implementation information. And the fourth thing that you have to take into account, whether your results has been clearly important to improve the child and family well-being. Because you are testing many things that are important for you, for your academic point of view, but in the end, you can say that your programs makes a difference for these families. So, and then again, to be more sensitive with the families and the children well-being is also important things to be taken into account when we take this approach of scientific evidence. So scientific evidence does not come only from efficacy. It comes from effectiveness trials that are very, very interesting and very complex to capturing the scenario in which I apply the program and many more things. So we have this, but also when we are talking about the practitioner point of view, we have to, in our field of social science, we have to upgrade a little bit and to go to the consensual information that comes from the teamwork, for instance. Because when you go only to the individual experience, that can be great, marvelous, I do not hesitate on that, but it's not transferable. It is not easily transferable to the others. And that is a problem, because then the people do different things with the families, can make in one service, can find different way to deal with that. Well, that makes really doubt to what extent you are presenting a coherent framework of attending to families. And so then we prefer to select the kind of experience that has been reached an agreement status. So somehow at the teamwork, somehow at the service level, there have been a clear proposition of which are the best practices, and they try that everybody follows it. even if you have been working there for hundreds of years, but you should be humble and to say that new things are coming and you have to share and agree with others in the kind of attention that you are giving to the family. So that is the consensual and share. Not only consensual, because I have been consensual, but then I do not do that. So it's really, really a sort of share. But also, when you come to the family side, it's not just the end point of the chain. Because you have to take them into account, I told you one reason for taking them into account, but also because they are very good informants on the quality of their receiving. And because they are subjects of right, they have the right of that. They have the right of being here, the right of being listening, and the right to participate in the decision making during the process. Not only, well, you have that is your problem, I can tell you how, and then in the end I will ask you, please obey me. This is key. It's terrible. It's taking from the worst model of the medicine, the worst one. That's only, I do not say who are you, I just have this protocol, and I will give you the pill, and then I will see at the end if you are following the pill. Sometimes they even didn't ask for that. So if we do that, it's terrible because where are the families? Where are the children's rights? And the children's rights is not only participating in the process, along the process, but also to participating and telling, gathering their ideas, also for the children, to what extent they have been receiving a support of quality. The idea of quality, and of course, you are aware that has been asking many times the question of the satisfaction. Are you satisfied? Well, this is a good way to start, but it's a black box. What does it mean, satisfaction? For me, it's just because I go and I feel happy because they look at me, I feel confident, I feel that I care, I matter, but for others could be other things. So we need to go deep on that and see what does it mean for the family, for the children, what does it mean equality care from the services. So you got this triangle in all the directions, then you come up with a relational, translational framework. Not only directional, not only science and say everything. But science is important, of course. I'm not telling that it's not important. I'm just trying to adapt to the kind of science that we are relying upon. Next one, please. So the quality assurance objects, who are these? Which are these? Of course, family, the quality of family support services is very important. It's what we are trying by implementing quality assurance systems. And you will see what does it mean. That is very good to say in the first instance, but you have to do it. And of course, and addressing inequalities of access, and that is set in the as a principles, the equality of the access. Of course, kind of experience, outcomes of the country, many differences that they got from one country to another, but you have to apply those agreed principles, and I mentioned before, quality standard and measurable indicators. They are already indicated on the left, and they created a national and locally collaborative scenario. We cannot come from Europe and say, you are good, you are bad, you are sad, because it's very important to include, to embark, to engage those countries in promoting their own quality standards, not their own quality standards, but the idea of promoting standards, promoting quality. The very idea of that has to be promoted first, because many countries are just doing what they are doing and do not questioning about that. So it has to be also nationally, that is very critical, and also to develop, of course, you go to the national, but then you come up with recommendations at the European level. Suppose that you have to somehow not unify in terms of bold and unify, but in terms of giving them the best formula that helps them to get better. And for instance, in this sense, we do not make drinks, for example, rankings for the countries. No, it is not good. It is not good because then you are saying you are the best. No. We just give that each country gives their own formula to do it better. And then it can be a model for others that are almost at the same position and want to improve. That means a kind of a kind of evaluation that is formative, not is for ranking points. Please. So then we go to the details of the quality assurance protocol. Of course, what we did for first learning from what has been done, and I'm really happy with Martin to share with you all the information we try to gather, because it's a very complicated, it's not already compiled, because you can find recommendations, you can have legislation, and then all the things, policy remarks from different countries, and also, of course, European level recommendations. So we started with that, but then do a kind of comprehensive reading, a comprehensive approach, and find a family 68 from this first reading. 68 was too much to go into a survey that was clear for us, but we tried to go in detail, not forgetting any important things, and then empirically to develop at the end a reduced version. And also important, the Delphi method that Susana will explain, Cristina will explain later, the coordinator and Professor Jiménez. Final version with 20, final but provisional version with 29. Is the following. Well, imagine that we have finally our quality indicators that come from the quality standards. That is a great achievement by itself, but it is not enough, because having this said, how can I make that these kind of quality standards are assumed, adopted by the professional practice? That is a long way. I could say, this is that is the principle, these are the standards, but then how I make that in Milano, in Padua, in wherever, in the social service of Milano or whatever, they really apply this. Then you have to face with the reality. And the reality is extraordinarily complex. In Europe and in every country of Europe, it's a nightmare when you try to typify somehow that. So, but then at least you have to think that what we are trying is to monitor or to try to see the adoption of these quality standards, and to recognize from the very beginning that there is a very a kind of systemic transformation involved on that. You cannot say from the outside, from the science, from the coast European project, say, well, that is that, what is that, and that's all. Because you miss the most important part, which is really to see to what extent the adoption of this standard has been made, but the adoption has to do with the systemic transformation. And which system has to be transformed? That is very complicated, because they have to be transformed, first of all, if you think of the way the family supports are provided, first you have the first line professionals working in a local services, and then you come up, and I'm going from the back to the upper part of the transparency, going to the family support practice system. The way the family support is really practiced, really transformed into professional practice in a given service, in a given social entity, whatever. So the practice level, when the families are entering into the services and make a professional and start all the process of pension. That is very important level, but not all what happens in this level depends on the level. Depends on the next one, which is, as you see, the family support provision system. Because if I live in one place, for instance, in Spain, let's say, it's not the case, let's say that only high needed families should be taken care in the social services. In Spain, it has been happening like that. So only high needed. Now they have they have broadened the field of target families, including also that are in the way of, or even families in their diversity that we have now. Not only because they have social risk, psychosocial risk, because of the way they have a certain ecosystem in the family, certain circumstances that make them worthwhile to work with them. And so in this sense, you live in a country that only high needed family are attended, you just go to the family to say, this boy, should I take him out of the family or should I keep it here? This is the beginning of the social protection system, of the child protection system have been seen like that. Come in and say, you stay, you're out. You're out, I'm referring to any alternative care. But this is not enough. I'm just telling something that now is, of course, not recommendable, but this is the kind of thing that can be modulated, and also the modality of delivery. You will see many examples of this service provision system. But then the next one is the new one, is the kind of system that is not easily taken into account because it's the evidence system. Do you think really that local services, national services, are aware by themselves of the kind of innovation, the kind of knowledge mobilization that is taking place with a given topic? No. Look at what has been happening with the COVID pandemic. When finally they came up with the vaccine, when a vaccine came to a South African country, a South African is not so, let me say another one, in Africa or in Asia, whatever, then it's not so easy. Well, I have the vaccines, and then comes the other. Then comes how to tell everybody that this is good, how to really get the people to know about what does it mean, this prevention, because you will find out people that are skeptical, that even they think that they are bad. Also, we have in Spain a group of families still telling that was a kind of devil thing that came to our minds, the vaccines and things like that. So you have to work a lot. The way these vaccines are converted or transformed, or the vaccination is transformed into an everyday practice in the social service, in the health system, especially in the health system in this case. And they have to work a lot. But the health system is very well prepared for that, because they know from the very beginning that the scientific evidence is not so easily transferred into a protocol, into a given social services or whatever. So it's difficult, and that means a lot of systemic transformation, but driven by this evidence-based system that is really aware of taking care that all the knowledge mobilization is taken care in the other two systems. And whereas the first one is local, the other can be more national, but this one can be driven by national, but also by local. Imagine in country and in developed countries, and you find wonderful ways from one local place that they are doing beautifully to promote and to create prevention and to do what do not have at the national level. So we have to be open in our mind and not to look for this evidence system only at the very national level, because it can be some instances of this evidence system coming from the local level. So it's upwards and downwards working at the same time. I'm going a little bit faster now because I know that I'm getting a lot of time.
Well, 10 more minutes.
Oh my goodness, then I will go because we need to have the results. This is a kind of examples of the kind of things that we can look at the family support practice system. Of course, you will see, I mean, it's not real, it's not so difficult to think of what is going on in a practice system. Of course, you have the family professional relationships. That is very important, of course, the quality of these relationships. We will have also the service organization. That is critical because in some services there is no time to reflect on anything. That is given, that is very important, the governance, the leadership, to what extent the things are organized to support the practice, the real quality practice, and also the kind of intervention. Are they evidence-based information, or just improvising, or just using just these individual models of wisdom? That is the kind of things that we are exploring. Then in the following system, which is I'm sorry. Yeah. Yeah. Ah, vale. Then no, pero falta el resultado. Ah, bueno, vale, vale. Ah, para mí. I thought that would go to only 10 minutes for the rest.
No, 10 minutes for you.
I was just, yeah, provision system. Here, you have a lot of things. You have policies and associated guidelines and legislation. That is a nightmare of things that have been given at the European level, but also at the national, even at the regional and local level. Because we have a complicated system in Spain, we have 17 communities and 2 autonomical cities, I never forget it, which are Ceuta and Melilla. But policies are associated, so we need kind of supported policy, financial support and work-family conciliation measures. In Spain, we have a lot of laws, but still, you cannot say that we have a really, really automatic system of family work conciliation. But also, to what extent they are accessible, responsive, and needs-led, broad, and inclusive provision. Or you just say, only high-needed families, and the rest, they are good families. With continuum of support, there are many different types of support. So it's not always the same one. Suitable and sustainable and adequate. Coordination mechanism, that is very important, because what the health system does, it has nothing to do with the education system does, with the social system does. That is really, in our, for instance, in Spain, it is typical to have a law that is produced by the Ministry of Gender Equality that refers to minor people and do not ask what are the opinions of the minor people ministry. Let's say the name, no? It's not this name, but give you an idea. So if you are including in the gender law, general law, if you include the minors, you have to hear the voice of the people who are. It happens that it was not the case in some occasions, and then the disasters started to come in the practice when you bring this to the practice. So then it's a good idea, the coordination. It's a good idea to have the person centered, and also when you are addressing the family needs, also to have a person centered approach. And here I'm referring that we do all the things we are doing in the social system. Sometimes it's only rely on the women, because women are the majority of people, and women are the majority of persons that comes when they ask for support. We miss a father. We miss even the typology of the family, because probably it's not the father, but a grandmother or an ex couple that are taking care of that. So we follow systems very biased when someone comes and you say that these people are giving the point of view of the family without taking care the possibility of their others being that you are not taking into account. So that is critical. So it's good to have both family-centered, but person-centered, or even typology of family-centered, at least. But typology are very diverse. And so it's also important to have the quality workforce in family support provision. You have to see which are the systems of training of the professional. You need to have, that we do not have, a capability standards. So what are the requirements for to be in a social service or social entity? Just to be a psychologist, just to be a social worker, just to be a social educator or whatever, is not enough. Just to have the master on, of course, I know that we got these qualifications, but what about the real skills, the real mentality? What about the attitudes? What about the values? Are culturally informed? Not you miss all of this, and then you find out a person that is, wow, behaving horribly with a person that came from migration, for instance. No, it's not the first time that happens. It happens many times. So quality of the professional workforce, that is very critical. And it should be done. Of course, I can do it at the local system, but it should be somehow taken into account at this provision system. And also the characteristics of the services is also very important. Financial support and work-family conciliation, what I saw before, accessible, responsible, and needs-led broad and inclusive provision, continuous of support, coordination mechanism, person-centered, what do you think? Oh, it's the same thing here and there?
At the level of the services and
At the level of service, sorry, yes, at the level of services and the level of the supportive policies, of course, should be mapped. Next one. And here it comes the jewel of the crown, what was not done before, because it's the evidences, the evidence system. In the evidence system, you need a structure. This cannot come like a flower in the fields, easily. It doesn't come so easily. It should come at least a collaboration between policymakers, researchers, and professionals. And that is a miracle, to finally have all these three agents speaking together, creating policy, creating kind of guidelines or doing whatever, but in common and taking into account the same point of view, or at least articulate the diversity point of view. But you need evidence structure, because you have to have the possibility of really testing, or really empirically testing, to what extent this country has enough quality, engagement, or support providers, stakeholders, children, because this is not a matter of several researchers that are bring with a brilliant ideas, but they have to be somehow shared and consensual. But also, that is very important, the relational translational efforts, because this is not directional. I need to establish this relational, for instance, involving scientific evidence, consensual practice, and family, what I said before in the triangle. Consensual guidelines with which practices. Finally, to come up with the best practice guidelines, and I can go to the services and to see to what extent these services. But I can do it externally, like in some countries that have established a sort of external assessment, or I can do it by the way of self-assessment over previously consensual protocol. Because if every country do it by themselves, or every service do it by themselves, but with different quality system, then it's impossible to compare. Consensual guidelines with interprofessional competence. Very important to reach the level of translational. Remember the kind of discipline, interdisciplinary, and the best one is the translational. That means that professionals from different disciplines get into a common framework and decided the same protocols, deciding how to act with different types of families. So all of them update their frameworks and get into a level which is called multidisciplinary, or even more transdisciplinary approach. On the other side, we have to have the implementation. That is critical. So how can I do it? How can I make it? I'm talking about the evidence system only. And so that means, for instance, effort to evaluate the quality of the service. That has been approached, but it can be done in this external way, or in a self-assessment procedure. For instance, in Spain, we have been doing all of that in a very, well, let's say, almost 10 years, in this way, which is self-assessment, but with a protocol already made and shared and consensual. Training professionals on the best practices, and dissemination. That is still lacking in Spain. So we have done, I think, a good work, but still we have to develop a sort of dissemination with the family, because the family do not really know all of this work that we have been doing. So we need to disseminate which are the kind of best practices and which are their point of view, or also the children's point of view on that. So it is still lacking in Spain. Hopefully we. Next one, I think is your part. Well, that is your part.
Sorry?
I think I did, I think.
I think it's very important, all the framework that María José has provided, because that's the conceptual basis. I think it's better, no? So that's the conceptual basis to understand what is being produced. So I think that it's critical that we dedicate the time to that. We would like to talk a little bit about the results. As I told you, this is an ongoing project, it's 1 year project, and I think even yesterday we were uploading the information from one country. So what we have still is very preliminary. From the 20 countries, we have information from 19, so still is not the final data. And also, this is the first level of analysis, I could say, because we are in the growth mode. We are talking about cultural sensitiveness or cultural validity and diversity, but we didn't have time yet to go into the details. So this is a really gross analysis. But I wanted to share the global picture about what's the kind of information that we are gathering from this model. And we have been assessing, as María José has clearly explained, quality standards and specific indicators. So we will have information about how we are at the national level and also at the European level on that regard. So that's a tool for self-assessment and at the end, for sure, to provide European guidelines. And also we have asked each country to identify strengths and areas for improvement. So as I refer to national working groups, so each national working group that was made up by not only academics, but also policymakers, practitioners, and family and children representatives. We try to include both the national, the regional, and the local level. We have asked them, how would you assess, this is a group evaluation, how do you assess these indicators in your country? And after having those indicators, what would you prioritize as a strength or as an area for improvement? That give us the opportunity to learn about successful experiences. We didn't have time yet to analyze, but we have qualitative information about what did you do to have this strength. So that gave us a lot of lessons about what did work in the Netherlands or in Italy or in whatever country, and how can other countries learn from there, and also what are the recommendations for improvement. And this is the reason I was referring to a developmental process, because you can start now saying, okay, this is an area for improvement, what can I do? What should I do? So it's not really, these are not planned for actions, because this group has not the capacity to say this is going to be done, but this is a group, an informed group of, we can say, experts that can say, these are possible actions to progress on this regard. And we have gone also in detail on facilitators and barriers. What could help to make this transformation? And, well, what could be a barrier to make that transformation? What are the training needs that you are identifying? Because remember, we are thinking this as a developmental model. And what's the impact that you expect in the practitioners, in the policy arena, for children and for families? So it's a lot of information that says, I won't be presenting all of this, just a little bit about the first two sections, but it's a lot of information that can fit the national level. And as I say, the experience, I think, is homogeneous for all the countries that have participated, is just meet together and think about this. It's a transformative process, because we are really thinking about all the standards and aspects that María José was referring. How is this in our country? What's facilitating this? What's being a barrier? And that's a self-transformation process. And also this will give us clues for the European level, and Professor Herrera will be introducing later about this, how this can help us. I will provide something about the global analysis, but these lessons learned, how can fit these European guidelines? And for sure that European, hopefully, policy impact can at the end go back to the national level. So that's the reason I was referring to this double layer structure or this iterative dialogue, because it's the way we try to formulate. So if we want to have a global picture in Europe, what you have here is an example of indicator. We are now finishing the edition for the publication of the protocol that will be available after summer. So that's the reason you don't have yet the protocol, the full protocol published. But you can see here an example, because I think this is important to understand then the data. We use 4 levels for ranking. Well, it's not always a Likert scale, it's multi-choice sometimes, and then we have a recoding for that. But at the end, we have 4 levels. And we have tried to do is operationalize really well what means 1, what means 2, what means 3, or what means 4. And it's different for each indicator. In this example we have, this is from system 3, and has to do with the implementation, because it's the incorporation of those best practices, of the implementation of those best practices that, well, has some characteristics as María José explained before. So what we are trying to have is a consensus at the national level. What's the situation? You can say, well, there are a lot of limitations, this is only national. As I say again, this is a starting point, this is what is manageable for 1 year, and for sure it could be better extended at other levels, but we start in this way. So from these national working groups, a group of experts or key stakeholders, what would you say is the general picture in your country? And in this case is being aware of those guidelines, some individual use, but not always spread. There is a shared use, but it's not universalized. Some services use and other services not. And we could say, well, it's quite fully adapted. So that gives us, and for this is only one example, if we take another one, the 4 levels would mean a completely different thing, because the operationalization would be different. But at the end, we can understand that 1 means almost nothing, and 4 means this is a strength, and for sure always there is room for improvement, but it's quality, it's something that is a high quality. And we have 2 different levels in the middle. We understood that, or we try to operationalize in the way that these 2 is still a lack, a gap, something to address. And the 3rd level is, well, it's quite developed, but still with room for improvement. And we will have more details about the Delphi process, and I have been referring about the national working groups, but just reading this, you see this is an expert evaluation. What we say, I mean from the perspective of the methodology, it's expert reporting. So is this group of people that together have a joint view, so no one could reply to all the explanation that María José said. I have a full view of what's going on in the practice and the provision and the evidence system level. That's impossible. So that's the reason we have groups between, I'm saying to Sofia because she's in charge of analyzing that piece, I think between 10 or 12 people to 40. So this depending on the size of the country and the characteristics of the country, but there are a large group of people joining together to discuss about this, and it's the shared view. So at the end you have 1 response per country. Is this understood? So at the end we have 1 single response. So So this is the average information at the European level for the 3 systems. I will now go into detail. And this is only the average, but you can see here that the average are in a place between 2 and 3. That should be, well, there is a gap or there is an area for improvement, but not that bad. Something has been done and some progress on that regard. And we are now working with our report on this, and we will be providing averages because this gives us the sense that the evidence system is the one. This is really gross numbers, no? It's really general numbers, but as an average, you see that this system is the one that requires more improvement, but the medians and the interquartile range that I'm sure that you are familiar with give us a clue about the dispersion of the information and where are the most of the responses. And what is interesting is that here you can see even the average is higher, the dispersion is also higher. So this is also reinforcing, and I will refer again now, about the idea of doing this from the bottom to the up, because the situations in the country are really different. So what you are seeing here is just general numbers, and we have to go into the detail. So even, and something else, and apart from the inter-country variability, we also ask each country for each one of the 29 indicators, say if this indicator there is no variability through the country on that, it's mostly homogeneous, so just low variability. If there is medium variability, so we can say, okay, our country, for this indicator, our country is rating 3, but this is representing the full perspective, but there is some variability in the country. And we have the 4 that say, I'm saying, let's say 3 at the end, but we cannot be fully, sorry, this should be a 3, not 4. Saying this in the country, but we cannot say that this is the average situation because there is a lot of variability. And inside, these are the medians of the countries, so I hope this is understandable because, I have been reading several times, but it's the first time for you. You can see that in the 3 systems, we have punctuations between 1 and 2, mainly, and this refers now to variability. So, between low variability and medium variability for practice and provision system, but what happened with the evidence system? It's medium variability. So there is no homogeneous situation in the 20 participating countries with the standard that has to do with the evidence. It's the system where the variability is higher, and probably because it's the more difficult one and the highest innovation. So if we now go into the detail, if now we go into the detail to specific standards, I'm not going to indicators, but to the standards more generally to each system, we can see here the medians and the interquartile range for the practice system. And again, what you can see is, there is some trends. You can see, for example, this has to do with confidentiality and ethic principles. Most of countries are scoring between 3 and 4. So that means this is a strength in Europe. So we can say we have progressed on this. And I am sure when we do the qualitative analysis, we are going to get a lot of information about successful experiences. You can see the best interest of the child. So this is a right-based approach. There is no almost variability. So it's placed here in 3, some in 2 or 4. But most of countries are saying this is a strength, still some room for improvement. And that's the differentiation that María José was doing about what's in the regulation and what's applied in the real practice. And that's the reason probably you have here a 3. And you have also regular reporting. And this, I don't have time today, but we have gone to the sectors specifically. And I can tell you that regular reporting is more implemented in the social sector than in health, education, and justice. So that information has differences by sector. And you can see some range between 2 and 3 for the rest of the aspects that has to do with alliance with families, with going with a strength approach, responsiveness and timeliness of the information, a positive work environment, and alliance with families. And what is reporting the lowest is the use of evidence-based programs and interventions. So even we are in the practice level, for sure it has to do with the evidence system, but in the implementation field, we are not that good. Well, there is no one that is scoring 1. So that's also what you said before. And we have a room for improvement because we are here in the middle. So it seems that this can be useful for practice and policy, but it's not crazy to think that the aspect that has more room for improvement is the one that has to do with this evidence-based. You have here information about the family support provision system. And you can see here that in coordination, we have the largest variability, but there are several countries reaching a 4th. Yes, I'm saying well. And professional training is also, at the provision level, something that it seems to be better established for a large number of countries. And we have variability in the rest, because you can see that we have this dispersion between 2 and 3 with the rest of the aspect. That is having broad accessible support that are responsive to family needs, providing economic support, you have large variability there. We have then family-friendly working conditions, what has to do with the continuum of services, what has to do with this person-centered response, and at the end, if I'm not wrong, the adequate funding of the services. This is the largest variability is here, and has to do a lot with differences, inter-country differences. Okay. Here we have the final, the 3rd system, that is the evidence one. And again, you can see here a lot of variability. The participatory advocacy that has to do with gaining awareness between children, families, and large society about the importance of evidence is scoring higher, but also having larger variability. And you can see also here in the case of quality assessment that the scores are lower. So, as I say, this is providing key clues about some trends, but also informing us about the variability between countries. I wanted to tell you a little bit about the prioritization of strengths and recommendations. As I told you, we ask countries, what's the aspect that you prioritize first as a strength, and this is in the family support practice system. So at least half of the countries say, I could say, I prioritize as a strength this right-based and developmental needs orientation of the families, and also following ethical principles and confidentiality. And at least half of the countries say, I would prioritize, and we have to improve our collaborative partnership with families. We have to improve our strengths-based approach, starting from a family's needs evaluation. This is happening in social sector, but not in other sectors like health, education, and justice. The use of evidence-based programs, what is not is understandable considering the data, and this is a reality for all the sectors. It doesn't matter if you're in social, justice, health, or education. This is need for improvement, and also this positive cultural leadership promoting professional development. And in the practice system, that is the more local one, there was more consensus. I mean, this is majority of countries prioritizing this, but what is interesting is that in the prioritization of other systems, there is no this consistent pattern. So we cannot talk about trends, generally talking, and this is referring again about the need for a self-guided process. There was only consensus about the adequate funding of services. And I said half of countries, so 10 or more countries saying we should prioritize this and include actions or recommendations for improvement. But then was a large variability on other aspects. And I'm here pointing out those that were more frequently selected, but in the half of cases were selected as strengths, and in the half of cases were selected as areas for improvement. So this is telling us you cannot say from Europe, just do this, because each country is in a different place, I'm sure it's a local region. And that's the value of having this self-assessment process, that I can start, if I'm the best country in Europe, I have still room for improvement, but if I'm the worst country, I also have room for improvement, but my steps are different from the other country, and that's an important lesson. And you have areas that were prioritized, but you can see as strengths or as area for improvement, so differently. This accessible support that is adjust to diverse needs, family-friendly working conditions, and an inclusive approach that is respectful, specifically with cultural diversity. And this is the final one, that is the family support evidence system. Was named for more than 50% of the countries is the existence of a trilateral collaboration between researchers, practitioners, and policymakers, and quality assessment of the services. So most of countries are prioritizing these two aspects as something that needs to improve. And again, variability, and this is the aspect that gain more responses, but with variability, has to do with the exchange and dissemination with the relevant audiences, and that's work that is being done by our colleagues in the working package too. So this is my final slide. I think I'm on time now. And this is just some final remarks that are not adding nothing new to what have been said this morning, but we wanted to strengthen some key messages for us. First is the innovation of this proposal, and is an innovation project actually. So it's something that we hope that can contribute to develop better a quality assurance model in family support arena, that, as we say, is not based on the vacuum, but starting from what has been done at the European regulation, quality frameworks from other entities, and also previous empirical efforts. And it's a rigorous process. So besides we are talking about self-assessment, it doesn't mean that it's not rigorous with the lesson learned that we learned from Eurofamnet, the therapy process that will be presented. And also we have this policy and practice group that this summer is going to review what we are doing and is providing feedback during the full project, but more specifically in this stage. As we say, this self-assessment process is a developmental way, not only for 1 year, but we hope this is able to produce change in culture of evidence, promote social innovation, and motivate this systemic change. And as we say, these national working groups are provoking what is called, the evidence ecosystem. We think that we are really strengthening this evidence ecosystem through this group that are being able to provoke this knowledge mobilization from this multi-agent, multi-sector, and multidisciplinary approach. And the last remark to share with you that we hold this kind of ground. Some lessons at the national level, for example, in Spain, we have been already asked by the ministry to present the Spanish results and to think and progress about, well, how can this be included at the Spanish level to progress? And our colleague, Professor Herrera, will be presenting later how this can have an impact at the Europe. So that's everything for us. Yes?